Casper's number one for New Country, My Country 95.5. It is Doc, Prairie Wife, with me via Skype. And on the phone, so thankful that she's allowing us a little bit of her time, Amber Espinoza. Amber, you're a Casper College alum, right?
I am a Casper College alumni.
Yeah, so awesome. Amber works on a full COVID-19 unit in New York City. So, Amber, how recently were you in Casper?
I've actually moved out of Casper about 5 years ago, but I spent about 15 years there. And I graduated from the Casper College Pharmacy Technology program and the Casper College Nursing program.
Gotcha. Now, out of respect to the doctors and hospitals you guys are working with there in New York City, I want to ask you specifics about location, but what is your mission there in New York City with the COVID-19 team?
Right now, I'm just deployed here with thousands of other nurses throughout the United States. We're just going to all the other hospitals in this area. We're not necessarily dispersed by our specialty, but we're all on COVID units.
So now, if there is such a thing, what would a typical day be like for you and your colleagues there?
We get up, we have to be downstairs and on our buses an hour before our scheduled start time. We travel together every day to and from work. We show up in an auditorium, we get our assignments for the day, and then we're just dispersed out to our unit.
I think a lot of us, especially those of us here in Wyoming that haven't had the virus or even know anybody that's had the virus, it's hard to understand how serious this situation is. What are you seeing on the ground there in your work in New York City?
This is very serious, Doc. It's hard to imagine when you come from a place like Wyoming where there's not a huge population. But in New York, people are living so close together. Sometimes it's hard to keep that 6-foot distance or social isolation. These COVID units, people can come in alert and oriented and walking, talking, happy, just having a little bit of shortness of breath, and within days, they're gone. Yeah,
it's unbelievable. I've seen some of the pictures and video of some of the different rooms in some of the hospitals, and it's hard to believe the percentage of people there that have been infected.
It is a huge percentage. My first few days here were actually pretty horrible. People were dying left and right. The triage here is a little different. You got to figure out which ones you're going to save, and these people are in hospital rooms that are 4 people to a room with no curtains, and they're watching each other die.
Yeah, and in many cases, they can't have family members with them, right?
There's no visitors allowed in the hospital. For the longest time, they weren't even allowing people to come in and see them after they passed. They just started allowing one family member to come in with full PPE after the person passes, or within the hour, if we can catch it, to be by their side. But otherwise, all they have is the nurse.
Yeah, that's incredible. So seeing what you see, do you have fear for your own health and that of your colleagues that you work with?
Sometimes we can get a little worried, but we know why we're here, and we have been training for this our whole career, so we just know how to be safe. We do the best we can. Yeah.
We have Amber Espinoza, a Casper College alum, who's working on a full COVID-19 unit in New York City, visiting with us. So Amber, knowing what you know, and after everything you've seen there in New York City, what would you say to your friends here about how to prevent it from getting worse in Wyoming?
Well, I'd say, for one, you guys are real lucky to live in Wyoming, because although you may not feel like it, the low population is actually helping us a lot. However, you got to think that even though we do have a low population, we also have very little beds in our hospitals there as well. So it kind of one outweighs the other, So I would just say, wash your hands, stay home. If you got to go get groceries, don't take your whole family to get groceries. Get a list, go one at a time. Wear your mask, wash dirty surfaces. Just pretty much everything that the news is telling you to do, you got to keep doing. We're seeing our numbers drop. If we start going out and doing what we think we can, then it's probably just going to go back up.
Well, Amber, please know that your service and your sacrifice are appreciated. Your courage is definitely inspiring to all of us here in Wyoming, and please know that our thoughts and prayers are with you, and please give our best to your colleagues as well. We're right there with you in spirit, and appreciate you guys running right there to the front lines to try to defeat this thing.
Thank you. I appreciate it.